Now to a story of survival. Quick actions that help save a local man's life.
What happened to him could really happen to anybody. Would you know what to do to help someone else, or even yourself? We're talking about a stroke right now, and our Amy Frazier has actually met with somebody who this happened to, and she's here now to tell us more about what people need to know to save lives.
Yeah, I met with a neurologist today who tells me there is treatment for a stroke if you act quickly. She says too often people try and wait for the symptoms to pass. A local cab driver is alive and well today because he got help quickly. 66-year-old Sheila Metcalf of Hillsborough was his usual self.
Charmer.
When he left for work on December 16th.
No signs of anything. And
Harry drives the cab and had just dropped off a passenger when something didn't feel right.
I don't know what would happen if I'd have drove any further. I probably would have gotten into a wreck or something.
Harry was having vision problems.
There was no road. I couldn't see the road. You know, cars were just floating by or something. They're just floating. And that's when I passed out then.
Harry came to and called dispatch.
she knew exactly what was happening to him because he was slurring his words, and so she knew he was having a stroke.
The dispatcher got paramedics to Harry as fast as possible.
In stroke, time is brain, and fast recognition and fast response and fast arrival to the emergency department makes it so that we can treat patients.
I found out the acronym FAST is an easy way to remember signs of a stroke. Face. Does the face look uneven? Arm. Is one arm numb or drifting down? Speech. Is it slurred or jumbled? Time. If you notice any of these signs, call 911. Dr. Tommy Sampson was the neurologist on call when Harry arrived at Providence St. Vincent Medical Center.
So I got that phone call and booted up the robot and patched in from home.
Using what's called the Telestroke Network, she can evaluate stroke patients quickly at Providence hospitals, near or far.
I want you to look left, and with help from the staff in the emergency department, we can do a full neurologic exam.
Dr. Sampson figured out the kind of stroke Harry was having and ordered up a clot-busting drug. Without it, and quickly, she says Harry's blood clot could have been fatal or left him with serious brain damage.
But I'm feeling a little bit better each day, and I'm glad I'm here.
And Harry tells me he does have a little bit of memory loss and he will need some physical therapy, but again, he is grateful to be here, and so his wife of 39 years is pretty happy about it too. How about that robot?
A robot.
We both were like, what?
A robot.
That is incredible.
Yeah, so she can do that from home. They've got a whole network of hospitals, especially consider like a rural area that might not have a neurologist like that, and she's still able to help, you know, working with that staff in the ER, and in this case it made all the difference for Harry.
So the nurses in the ER are actually going to do the tactile things.
Sure.
Yep. Gotcha. Okay.
Yep.
Wow, and to know those steps too. We often hear about CPR or other things, but stroke maybe isn't something we always hear about. So just to know what the symptoms are, and if you hear anything, just call 911.
Go right
just
away.
in case.
Don't wait.
Wow, Amy, thank you for sharing that.